place. And another long-term care operator is raising concerns over what it says is insufficient provincial funding, warning that without changes, staffing cuts and the loss of services and beds could follow. CTV's Kevin Karach has more, including a response from the Ministry of Health.
Karen Bernstein has lived at Brier Care Home for 3 years.
The staff is incredible, kind and loving.
But the place she calls home is now facing a budget crunch.
Our funding isn't meeting the current costs.
David Keselman runs Brier and says provincial cutbacks, including recent reductions to pandemic-era overtime and nurse agency funding, are taking a toll.
We need that to be updated and reflect the current needs. The current needs for renewing supplies and resources, for meeting the needs of our residents. Everything has changed. Cost of living, cost of our utilities, cost of our food.
Brier isn't alone. Harrow Park in the West End is already seeing the impact of staffing issues.
That meant residents went without showers.
We have dozens and dozens of facilities across this province who are experiencing the same thing, many of whom are saying they're either going to have to stop taking new admissions, which leaves seniors in need in hospitals or in homes where they can't properly be cared for.
Vancouver Coastal Health tells CTV News it recognizes care homes may have concerns about the withdrawal of pandemic-era funding and says it's working closely with operators to address any challenges. And BC's Ministry of Health says it's monitoring the situation and working to develop a sustainable funding model for long-term care.
But back at Brier, the clock is ticking. With a budget deadline in the coming months, staff warn that without new funding, tough decisions may be unavoidable.
Either lay off people or really cut services back, close beds if needed.
Leaving the future uncertain for the home's more than 200 residents.
I'd be disappointed. I'd be worried.
Kevin Karach, CTV News, Vancouver.